Join. طبعا. Guys, am I clear? Ah, 1 second then. Think should be the way around. Guys, am I clear? I think that is much better. I don't think even there is any echo or anything right now. Let me check on the Facebook if I'm live there. Please, guys, if I'm live on the Facebook, please, guys, let me know. And if there is any echo, also, guys, please let me know so I can do something from my side. Copy link. Post. Copy. Please, guys, if I'm live on the Facebook, please let me know. Thank you. Okay. We. Okay, guys, I believe we have waited enough for everyone. And then it seems like this is a good time to start right now. So, Dr. Navdeep, congratulations to you, Dr. Nav.
Thank you. Thank you so much, Dr. Bedo.
Thank you very much. I'm very proud of you. And I have seen you in part one. And then also in part two, I have seen how much you've been dedicated all the time. And you've been very smart throughout your journey. And then I always say, you guys suffer a lot and you have lots of things happening during your journey. And that's why I appreciate your work and I appreciate your dedication. And that's why I'm very happy and proud of every one of you. Thank
Thank,
you very much for making us happy.
thank you so much, Dr. Bedo. I'm very grateful. I got this opportunity to share my experience with all the candidates. So I will try my best to answer all of their questions and to motivate them.
Okay, that's great. And so for the next, I would say the next half an hour, it's up to you. If you want to take half an hour, that is okay. If you want to take 15 minutes, 1 hour, definitely is up to you and depends on the questions as well.
Sure, sure. Will
Okay, and then yes, and then we go in after this to start. If even would like to attend our my sessions after this or role play for more cellular hypo mineralization, I'll be very happy to. If you have any responsibilities, so in this case, definitely you actually happy to go. So now it's all yours right now, everyone here, because they want to hear you and listen to you. So please start right now.
all right. Good evening, everyone. My name is Navdeep. So I was also one of ADC candidate. So I just got my results few days ago. I think on 17th of November, and it was a pass for me, and which was actually a big day of my life. So I cleared my part one in 2023, and fortunately, I could able to make it pass in my first attempt, and then that's where I started my part two journey. So it's been very challenging for me to pass ATC part two exam, but I have been very consistent with a lot of hard work, dedication, and with the help of tutors. But I would say we can all do it. So this is just today I can say this is a doable exam. So we can do it. So this was my fourth attempt. So I have been failing in like one either one or two clusters, sometime either technicals or sometime IOSKI communications. So but this time I could pass all my stations, and I cleared all my OSKIs as well. So do you want me to talk just generally, or if you have any specific question, you can just write it down. I would be more than happy to answer your questions. So how would you like to go? Like just to want to you want me to talk how I prepared and everything?
Okay, I will consider myself today as a candidate, and because I have really good experience about this. So, do you want to hear about your story? How did you start it? What things really has helped you the most? What did you do, either in part one, part two? What things really had make your journey easier? What mistakes you made that if you wish if you don't do them again? So, I believe everyone wants to hear to you first, your experience, and then after this, they will ask you questions.
All right. So for my part one, what I would say basically, I was just following Dr. Ved. Whatever study plan they were giving us, whatever material, books they were telling us to read, I was only doing that. I wasn't doing anything apart from that, but I was doing it thoroughly, like studying it again and again, just keep on revising things until last day of my exam. So that's all about part one. I haven't gone anywhere else, or I haven't studied anything out of it. So for my part two, so because part two is like quite a lot of things to do. So in my first attempt, when I went for my OSCEs, like honestly, if I compare myself today, I'm happy to say like I didn't deserve to pass, because I my knowledge was not up to there. I haven't read anything apart from just general scripts of these OSCEs. I think this is not enough to pass this exam. So during my second attempt, I said I just study the rubrics thoroughly, like where I have been lacking. So what I need to study more, just to listen to the tutors again, discussing with them like what we can do, and most importantly, guys, attend the sessions, because sometimes we do feel like, oh, I have done this case, they are doing again this case in the session, but even if you are grabbing a single line from that session again, that can actually help you. You don't know where it would help you, but it is really helpful for you. If you can grab a single word from the session, that is really beneficial. So try to attend those sessions and compare yourself, like, do I know this, what they are saying, have I incorporated that in my OSCEs? So make notes, write down the things what they are saying. And when we are doing role plays, I know we are doing with the study partners, which is a great help. So try to choose your partner wisely. Try to learn from them. Try to encourage each other, and in between somewhere try to book your role plays with your tutors as well, because they have been very experienced with it. They have been listening to many candidates. They know like what you are lacking, where are you standing, and which areas you need to work, they will give you really like honest and positive feedback. Sometimes we don't give that much feedback to like our friends. Sometimes we thought like, oh no, they might feel bad, but no, the tutors are really, they really help us a lot. I have been gone to many tutors, and I know like we all struggled a lot with finance or everything, because this is a it drains us physically, mentally, as well as financially. But try to do as much as you can. Do your role plays and get feedback on your technical work as well. Like just keep sitting at home and keep doing things, not having a right approach. I wouldn't say it would be very smart thing to do. So keep go to academy wherever you feel, whichever tutor you are following, get your work checked. And if you are struggling in any of the task, book your days, sit there, keep doing it, show it to them again and again, get the feedback. And I think all tutors are helpful. They really try their best to teach you, and they are so approachable. So don't hesitate to go anywhere, to ask anybody, because it's not an easiest thing to like sitting in this exam again and again, keep doing same mistakes. So better than this, it would be really great, like keep checking your work, getting your feedback, and keep polishing yourself. So like that's what my approach was. Because when we got like fail again and again, sometimes yes, we do think like, oh, it was my bad luck. It could be, but I don't think so like 100%. This means we are still lacking, we are still not there, we are not up to mark. Trust me, when you do your 100%, you need to be ready more than 100%, I would say. So you will definitely pass it this time. Like I look, because I have been very average student, honestly. I haven't been very brilliant, very intelligent. Even I used to struggle a lot in OSCEs as well. I used to get anxious, but I just kept doing it again and again, again and again, getting my feedbacks. And because once you do it again and again, you will keep learning, you start to get more confidence. um your skills are in your mind, you don't need to remember them. Then you will make yourself comfortable in the talk, in your talkings, and it will make you sounds more natural. You can work on your tone, and you will get natural pauses. You will address other people's opinion. Like let's say you will listen to examiner actively, because you have done it many times, you know where to stop, like rather than just keep reading it. So that's what I did differently this time. So whenever I was doing my like OSCEs in exam, I wasn't in any kind of rush. I just tried to do it very calmly, natural, sounds naturally. I was stopping. So I was addressing examiners, just saying thank you, sorry, wherever like it was needed. So these are the things like we really need to incorporate in our, even when we are doing it with the friends, with the tutors. So that's how actually it needs to be done. And I know it's really hard. This is not an easy exam. So but just keep doing it. Like you hard work, dedication, and most importantly you need to be consistent. Because like motivation, I don't think so it will be with you every day. It will keep go up and down, but you need to be consistent and try to make your discipline of your routine. Like if you have to do it, like you have to do it. So make your routine in studying articles. That is very, very, very important. I haven't studied, sorry, articles in my previous attempts, but this time, yes, I did it a lot. So saying this doesn't mean like you need to really add these articles in your OSCEs. No, at back of your head, you know what you are talking. So it help you to make you like sounds more confidence. You know what you are talking, this is the fact. So you can manage like any answer coming from anywhere, uh, any topic of the OSCEs, you would have that answer if you really study those articles. And your tutors like ask them questions as many as you can. Don't hesitate to ask anybody any question related to your OSCE. So and attend the sessions. So because it help you to like change your energy, it help you to boost you, and listen to role plays how others are doing. Sometime like we think, oh, this person's is not doing really great, but sometimes they said few things so you can like really compare yourself like how they are saying. um for example, some people really has a good definition of perio, they really said few really good words. So which keeps help to like expand your ideas as well. So listen to tutor, listen to sessions, try to keep getting your work checked uh, every now and then. So keep working hard, stay consistent. I know it's hard really, especially when you are failing. So I would share my experience. Like in my third attempt, my result was like worse than ever. Like I was so devastated. I felt like I don't even deserve to go into ADC exam. I said I cried a lot, but internally somewhere like I knew this is not me. I can do better than this. I know. So I promise myself like if I prepare again, I will not look at this result again and again. This is not me. It must have my bad day. I will learn everything from the beginning. I will polish everything. So sometimes like ra- things rather than keeping better, they started to go worse. It does happen like with me, many of us. But don't stop working. You just keep working hard. So it will happen one day. Trust me. Like if I'm sitting here saying these things, so because I have been through everything, like it's been, I think, more than nearly 3 years I have been in this journey. So it is hard journey, but you can do it. You like just stay consistent, stay dedicated, try to surround yourself with positivity. So if you feel like any of your relative, any of your friend, they are saying some things which are putting you down, please don't go there, don't talk to them. I know it's hard to stay isolated, but if you feel like no, their opinion doesn't matter to me, please don't go there. It's because you need positivity. You really need that thing. That's the only dose to keep going because you need something. So try to listen to whatever makes you feel motivated. Like even on the social media, try to like those things which can give you this positivity. You need a pump every day, you need it. I know it's very hard to wake up in the morning, keep doing same things again, don't know what is going to happen. So positivity is essential for doing this thing. And try to incorporate something into your routine, like anything for your mental health, exercise, breathing, gymming, anything that can work for you. Um, Try to listen to positive persons, I would say. So that's all. That's how I did everything. I know. So try to keep your approach toward even toward the examiners. Just try to make it very, very, very simple. This is from, I know it's hard exam, but from one side it's very simple exam. We sometimes we made it very complicated. So keep concising your definition, don't try to say and everything. Let's say it's perio case, they don't want to listen and all big lectures about it. No, all you have to just make them understand your gums need help. That's it. How we can fix it. So try to concise your definitions and keep modifying your notes. Listen to your recordings. So once I was just sitting, I randomly find one of my old when I started this part 2 journey, just my voice recording, which I have recorded for first time. I think it was said in the one of the Dr. Bedo's group. Just send your voice with definition of caries, and I had that recording. I compared it with something that I'm doing or even toward the examiners with definition of caries. Sorry.
No, keep going, please. Keep going.
Yes, so I was comparing my basically what I want to say. I was like comparing my recording, like how I was saying at first time, how I'm saying now. So it was huge difference. So how it came, it just came with practice, practice, practice. I know, oh, these words are not needed anymore. No, no, I just have to keep it very simple, very simple. So listen your recording. That is how I'm saying now. So um
That's okay. It's an echo. It's an echo.
okay.
Sorry.
So yeah, guys, yeah, that's what really helped me a lot. I used to compare myself a lot only with myself, like old recordings, new recordings, then again listening to them after a few days. So yeah, that's how like it really give you good like a boost as well. Like, oh no, I'm improving. It's working well for me. And I know like we are always worrying about the destination, like we have to reach there. So try to make this journey more learnable. Yeah, I know it's easier to said, but try to learn. Just keep your like goals towards learning. How I can learn, what I need to learn more about this, what I need to learn more about this. So keep yourself ready for, because the question they are asking, it's not anything like out of dental, or it's not hard question. These are very simple questions, but the patients has been asking in the clinics, because I have been working as TA as well. So trust me, these are the simple questions which patients used to ask in clinics. So we just keep, it's a good thing for you, because once you pass ADC, they will ask you again in the clinic as well. So this is same questions. That's what ADC been preparing you for that. So prepare for all the questions. So how you can set it simply. So just patient centered approach. So what we have been always like emphasizing, because you are all for patients on that day, even when you're doing OSCE, even in real life as well. You have to do like whatever you can do to make your patient happy. So try to be very polite, calm, understand what they want you to do. Even if you can't do something, so just try, say very politely sorry, give them reason like why you are saying this, why they need to go to specialist, why you can't do it. So that's all they have been looking for, like nothing else. So if we think from one side, it's very simple thing. I know it's hard, but it's not complex thing. So if we want, we can do it very simply. So that can thing can only come with practice, practice, practice. That's what I would say. So make your notes, attend sessions as much as you can, because in every session there is something. Trust me, I know it's hard. I used to sit for sessions. Sometimes I was really frustrated as well, but I never miss any sessions. Trust me. So that's all like how I did everything. So you want me to talk something else or any questions you are having?
Thank you very much for this. I was very happy whatever you said right now.
Thank you, Dr. Vedat,
And
for giving me this opportunity to share my thoughts with everyone.
Thank you very much for this. I really appreciate it. And I hope they listen to you because I know, look, there are champions here. I know them very well. They are actually taking their journey and their dream seriously. And the others really, they take it lightly.
I know
But what?
it's,
Hmm.
it's a tiring journey, no doubt. No, every day I was tired, literally. But if like I can help even single one of them, it I'm very happy to do that. Even if they are motivated for 1 hour, that would be enough for me as well. Because I know how much motivation, energy we need to do it.
I totally agree in this. By the way, I really appreciate this. And this always my thoughts. You know, sometimes I run behind the candidate to study. Like I run behind them, I try to motivate them to do the job. And I always tell myself if there is only one candidate going to do something interesting today, or I'm going to help one person only, that will be enough for me. I don't care about anyone else. I only care about this person. So I got your point. I know it exactly what you mean. I really appreciate this. Uh, yes, please tell me.
I used to listen sessions sometime. Like I felt really motivated. Like even for 2 days consistently, I used to do lot of work. I know again motivation drops. You again need it. So it is part of journey. So I know they need it.
I totally agree on this. And honestly, when I see them active and then they try to help themselves and then they ask questions and then they get motivated, I feel very happy too. Because I'm human as well. When I see them motivate, they are motivated, I become motivated too. And that's always our ways in teaching. Okay, so now, Doctor, there is maybe some questions start to here right now, but before this, I see Dr. Lev. Hi, Dr. Lev, how you going? And Dr. Natalie, how you going? Dr. Suresh and Dr. Jilan and every one of you guys. Now, let's light this class up. We very smart, Dr. Lev. I really like you very much. Okay, every one of you guys, Dr. Larry says congratulations. You know Dr. Larry, right?
Yes, yes. Thank you, doctor.
Thank you very much. Okay, that's a great. Then please, guys, if you have question, we start to take the question for the next 5 minutes, and then after this, we're going to start our class for the clinical case. Okay, so guys, you have only 5 minutes to ask, no more than 5 minutes. So please, guys, be quick. Hi, Dr. Walija, how are you going? So Dr. Walija mentioned guidance for part one, please. So what is the most important things you may help here in part one? Do you think it can help here in part one?
Uh, Honestly, guys, like I have already mentioned as well for part one, because this journey was like completely new for me as well. So I just blindly follow Dr. Vedo, whatever material they were giving us, their study plans to study have 1 day, second day. I was just following that and like mocks, everything. I attend his session. That's all I did for part one.
Okay, thank you very much for this. Dr. Sarandehi says congratulations to you, Doctor, and Dr. Kushi can say congratulations, Dr. Sarisha as well, Dr. Fatima, and everyone really very proud and happy for you. Dr. Haya says congratulations, Dr. Navdeep, you are really an inspiration for us. I totally agree on this. Thanks a lot for sharing your experience with us.
Thank
Thank
you,
you. Thank
guys.
you. Dr. Kanika say congratulations to you, and then Dr. Depti, congratulations, Dr. Navdeep, congratulations, and then Dr. Taslim. She's a multimedia person, always on her reels and stuff.
Mhm.
And then yes, and she says congratulations to you, and then also Dr. Lev. Okay, Dr. Lev says, I have two questions. Did you have a study partner?
Yes, definitely. I had study partner always. Like I always had like one of my friends. She has always been studying with me. So we used to study. We used to discuss a lot of things. Anytime we had any doubt, we used to call each other. We used to ask tutors even together, asking questions. So yes, I had a study partner. We used to do lot of role plays. We keep on changing our behaviors. So even though we were doing it with the tutors as well, so to get like you need second opinion. Like keep doing with one person sometimes makes you really comfortable. So you don't realize you are just doing it comfortably. So you need to do it with the different other peoples as well to test yourself, how your anxious level and everything.
I totally agree on this, but yes, it's very important. This is my suggestion as well to have a study partner as well. That is totally great. Okay, there is one more question here, guys. We have only 5 minutes. Give me this one, and then there's another question from Dr. Lev as well. How to stop overthinking? This is very smart question.
I know the I would say overthinking or just a feeling of fear. So we can say anything. We always have a thought like, oh no, what this has happened us. So guys, I know it's hard. You have to control your mind. There is no other way of doing it. So only think about learning. Think, I need to learn this. That's it. Whatever comes, I will deal with it. Whatever it is, I will deal it. I will just give my 100%. Trust me, this time I had this feeling, what if I haven't passed? This is my last attempt. But somewhere I was very happy. I did my 100%. Rest, I don't know. I will never regret in my life that I haven't done my part. I have done my part with whole heart. So these kind of thoughts always give me peace. So that's you, like you have to find, you do your best. This will actually help you to stop overthinking. Even my family was like, oh, don't think, you have done, we have seen you. This is, if you're not passing, it's not in your hand, but we have seen you. You haven't like rest for any single day. Even in my last month, I was just studying, sleeping, studying, sleeping. Even for eating, I because my family is away, I just eat like oats, banana shake, these kind of things which I can, which doesn't take a lot of time. So do your best. This will help you to stop overthinking, and it will help you to make you feel satisfied somewhere, like yes, you have done your part. That's what helped me always.
I totally agree in this part because in my exam was 7 days exam, and I always tell the candidates about this. From the second day, what I told myself at that time is, you know what? You already did everything as much as you can during the preparation time. So why should be stressed that I said, okay, this exam is just only for trial. You just try this time. You're gonna fail this exam and the next exam you will pass. So once I said this to myself completely, I felt I'm very good. I'm myself back again. I didn't put any pressure on myself. And then I think that's the reason why I passed the exam. So this is the best way to
Because
stop.
like
Yes.
everything is not in our hands sometime, but few things are in our hands, like doing hard work, studying, staying consistent. We can do it. Yes, we can do it. So try to do that.
You know what? I like what you say. You're very smart, doctor. I really like the way you talk.
And many things from you, Dr.
Oh, thank you very much.
Arts.
Thank you very much, doctor. Okay, Dr. Parasia asked question as well. Sorry, he said, congratulations, Dr. Nev. Well done. Love the spirit. Me too, Dr. Parasia. That is the way to go. I totally agree on this.
Mm.
Dr. Larian, she given always Dr. Larian gave big high, big ears, big eyes. So she's just listening to you with big ears. I can see. Okay, congratulations, many congratulations, and then Dr. Pido, your voice itself a motivation for us. Oh, thank you very much, Dr. Mosa, for this. I really appreciate. Guys, believe me, you are my motivation, guys. You can imagine once I see one of you guys pass the exam, how much I feel very happy. When I see the candidates very active and then they try to do their work and then they ask questions and then they ask for help, I feel very happy because I know they go on to pass. Once I see them, they slow down and then they don't do that much effort, I got very worried and concerned. So believe me, guys, you are my motivation too. So everyone really very proud of you and happy for you, Dr. Sainz. Congratulations, Dr. Kilventa, Dr. Shashank. And then Dr. Sangita asked question. Congratulations, Dr. Navdeep. If you don't mind, can I say whether you stayed in Australia or overseas, and how did you manage the financial aspect of the exam in part two?
So I have been staying in Australia, so I know like in terms of finance, like I know it's a lot, but I used to work as a DA, but I haven't been working really like very consistently. I only work for like 1 or 2 days. Even 2 months before the exam, I was like, oh no, I stopped working. I had my husband to support me, but again, like it's again, it was still very hard for us. We have been struggling a lot in terms of finance. Like we have been really dealing really hard with it to manage everything. But trust me, guys, once you see your result, you see this thing like you are passed, you feel like everything has been paid off. I know everybody struggles a lot. It's been really hard.
Yes, once you pass the exam, this is what I have heard one of my friend at my time. He said, whatever you, by the way, guys, the exam at my time was much more expensive at your time. The courses at my time was about $21,000, 21K.
I
At that time, do you remember? I don't know if you know this information or not, and was also 24,000, 24K at my time, the course.
like
And that,
like
mm,
I haven't spent anywhere in these 3 years, like not buying anything. It's been really hard, but I think it is what it is. This is ADC.
yes, but even what, tell you something, even the exam fees at that time for part two was 7,000 plus.
I
At
know.
that time was 7 days exam, very expensive. However, I have one of my friend at that time said, look, if you really go into, because he was a dentist, was just dentist, and he said, if you're going to pass the exam, all the expenses you paid, you're gonna get it back again in 6 month work only, and that was really very expensive at that time. Nowadays, I'm telling you, if you pass the exam and then work as a dentist, and then as an average, whatever you have paid, you're gonna get back in 3 months only.
I know.
So.
Like I understand. I have got my result like few days back. I know, like you all know, I haven't started working yet. But the thing is that the feeling of that achievement, it really like you feel like, oh no, everything has like paid off. Even I have borrowed from friends as well, so it's been really hard for everyone. Like it's not easy to afford all these finance. So one of my colleague, before the exam, I was discussing with him. He's a dentist. He told me one line. He said, Navdeep, do whatever you can do to pass this exam. Do
Yes,
like, yeah, anything you can do to pass this. Like from that day, I haven't think whatever I need to spend. I spent this. I spent a lot.
yes, I agree on this, and you never regret this. I will never regret this, doctor. Okay, Dr. Parsia says, don't lose your confidence, stay positive, isolate yourself from negative people. Totally agree. And the energy, keep practicing, keep reviewing, and updating yourself and notes. Attend all the sessions, even learning one new word from each session is beneficial. Get help from any source possible. Utilize the articles. They may not be necessary,
Hmm.
but will boost your confidence and what you say in communication, Oski. Listen carefully to examiner, effective communication, explain clearly, justify your investigation, get your technical work assessed by tutors. What do you think about this? You know what? I feel sometimes when I see this champions, I really call them champions. You know why? Because, for example, right now, what Dr. Parse made, he actually get out from his comfort zone and start to type for everyone. It means he has a big heart. He doesn't keep only information for himself. He try to spread and help everyone else. So that's why I feel like I want to give him big hug, and everyone here should really give him big hug for this. What do you think, doctor?
Yes, definitely. And in like everybody encourage, we encourage ourselves, but encouraging others, doing these things for your friends and your colleagues, it's really, you really have a big heart, Dr. Fars. I
Yes, he's helping everyone. I know this.
mm-hmm.
We have big. Honestly, we are lucky to have this community. We're lucky to have you guys. You know, it's really hard to find people like you guys helping each others, and we lucky always in academy. We have you guys. We're really lucky.
Yeah, and we all are lucky to have tutors like you.
Thank you very much, Dr. Podest. Okay, there is a question here from Dr. Shweta. Congratulations, Dr. Navdeep. How did you plan your day for part two, especially 1 or 2 months close to the exam?
So closer to exam, like so I just wake up, I start because I feel more productive in the morning. So I start doing my technical just after eating something. So I do my mocks every day. Every day I, even sometime you feel tired, you may take a break, but closer to exam I try to do my technicals every day mocks, and then in the evening I sit with my friends. We do like the whole set, one set every day, like three role plays some, and we discuss everything, and then I afterwards I do my skilled. So like from morning I would say 7 until 10 or 11 in the night. So I have been taking few breaks for eating or something, but it's like I have been doing it non-stop, I would say, just resting, eating, then start doing again. So closer to exam I would say do as much as you can, and keep reviewing your work is very 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 important.
I totally agree in this one too. Dr. Simran asking question, did you just follow the tasks provided by the academy or did you study more than that? Yeah,
uh,
for part one or part two. Yeah.
like for part one, like I have studied everything given by academy. Even for part two, see, part two is more of like your general approach. So none of the tutor like in I think ever teach you what to say, how to say. It's more of your personality. It you have to understand what you have to say. No one can really install these things in your mind. So yes, we do follow all the material given by academics. Apart from it, try to read articles, try to expand your knowledge so you know what you are talking. And guys, for the host case, one thing I would definitely say, try to understand the case. Every case has some message in it. Doesn't matter examiner is chatty, they don't let you skip. You have to pass that message somehow in your talk. So every word in the OSCE is important. This has some meaning. So try to have more understanding what it needs to be said, rather than like what to study, how to study, where to go. No. So try to focus on the things I would say given by your tutors. That should be enough. Whatever they are saying, you can read apart from it, you can definitely read article whenever you want. But it's more of yourself, like how you saying these things. You, I hope this makes sense.
Thank you very much. It does make sense for me, definitely.
Mm.
Okay, there's a question here. I believe this could be the last question, and then I would really say thank you very much for your help for coming here today and help everyone and motivating me personally. This is the last question because we actually have lots of other questions, and then we have a case we need to go through. So the question from Dr. Tasnim, she's asking, did you really be able to finish every task on time for part one?
Part one or part two?
Part one. Let's say part one first.
So like
But the question is general, but I assume could be part one or part two. So do you think in part one, the plan which I give it to you, look, my answer is no. Like, answer is no, you cannot. Well, what do you think?
yes, like see, if you are going right, so you are in doing it in a right direction, that's it will help you to do it simply and easily. Everything you can do in a time. But it's not like you have to finish. For example, you're doing a case, you just keep looking at the time. So time is important, but I wouldn't say like, even you're not talking to examiner but you're finishing it in a time, no way you can pass it. So no, time is no, even when we are doing technical task, people are saying, oh, I did my endo in 15 minutes, I did my endo in 20. I could never able to finish it. I took my time, and things does take time. If you have to do it properly, it takes time. For my every task, even I took like an hour in exam as well. I was just keep checking it again and again. You would not be able to finish everything in every time and perfectly. No, it's more how good you are doing. So like, I
Yeah.
hope help you to make.
This, this is great answer for part two. What about part one for our plans? Do you remember I give you plans and then the
Yeah.
task and stuff? Do you think will they have you been able to finish the tasks on time?
Okay, I got what they trying to
For
ask.
part one now. That's this for part one. You already cover part two. Now for part one.
I remember there was a criteria for days to do this in this. So try to do as much as you can. Like it's, and I know it's hard to like meet that time criteria, but to try your best as much as you can. That's all you can do.
I agree in this because what I gave them actually, I gave them a task that's to push them to study.
Yeah.
And then because they're actually different. We have people they stay at home and they are able to study for 12 hours,
Okay.
14 hours. Other people they only can study for 2 hours, 1 hour a day. So I give them as much as they can finish if they study 12 hours, but they only if they can do 1 or 2 hours, they still can doing good because anyway at the end I'm going to focus on the always, I focus on the very, very important things only for the exam, right? But they still need to be confident, reading things here and there. So once they get new concepts and a question that's not related to anything, they will be able to cover it. That's why I always do this,
Okay.
right?
Yeah, like moreover, Dr. Bedo, every person is different. Some people are doing things in 1 hour, other people are taking 3 times. So, like, there is no one specific answer for
No, I
this.
agree. I agree in this. Daughter, look, I'm very proud of you. I'm very happy. I really appreciate you coming here today and help all these lovely champions because I believe by yourself you used to attend the sessions before. Am I right?
Yes, exactly. I used to attend lot of sessions. And I try not to miss any of these sessions. Even I have passed the exam when there is 8 or 9 o'clock in the evening. I still think, oh, I have no session till now. So I was very used to attend sessions.
Thank you very much for this. I really appreciate it, and everyone is happy here today. You mentioned if you can motivate them for 1 hour will be enough, but I'm telling for one day, 1 hour, I'm telling you they will be motivating until their exam. I promise you, because really you talk, your spirit, your energy has added a lot to this people journey right now. I believe so.
I hope so that as well. Thank you so much, Dr. Widow. Thank you everyone for listening to me. So, but I would like to wrap it up. So, what I want to say again is that this is, you can do it. This trust me, this is doable exam. So all it need is just your hard work, your consistency, your dedication, and you need to be like stay committed to this exam.
I totally agree. And thanks very much for this, doctor, and have a great night because I don't want to keep you awake until late time. Thanks very much again.
Thank you so much, Dr. Beto. Have a good everyone.
You too. Thanks very much, doctor. Okay, guys, as you see right now, every one of you can be one day like Dr. Navdeep. She has actually did very good job. As you see right now, she said by herself she struggled a lot in during the journey as many of the champions. But one day, guys, you will believe me and believe Dr. Navdeep when she said everyone gonna pass the exam, which I also believe in it, regardless who you are, as long as you're going to do the right thing. Definitely, guys, we can do it. Okay, thanks again for you, Dr. Navdeep, and then thanks, guys, for listening to her. And then our purpose here and our goal is to make every one of you motivated at this stage and then start to study again because the exam is doable. Now, let's start. Okay, guys, I'm not quite sure if anyone will be able to do role play today or not. I'm very happy. We have more incisor hypomineralization case. It's an easy case. It's a very easy. It's not hard at all. Very simple. The way that you're gonna make it Simple, right? We're gonna make it simple today anyway. Will not be something very hard at all. Okay, guys, please, guys. Dr. Melzma, yes. Dr. Lev, yes. Want to role play? That's okay, Dr. Melzma. Let's see who else. And Dr. Lev as well. Okay, guys. Let's wait. Let me just get the case here. Guys, where are the people that should be brave to say it? Why, guys, not? You should be brave. Why are you scared? Are you concerned or scared? You see, it's very easy case. You just need to take a consent and address the parents' concerns and the child's condition. That's exactly what you need to do. No more than this. Something really very easy. Dr. Mubashir say anyone, it means that's you, Dr. Mubashir. Let me get you then. Don't run away. Stay here.
Hello.
Hi, Dr. Mubashir. How are you going?
Hi, Dr. Vida. How are you?
Okay, very good. Then I'm very happy that you didn't run away.
I'll try my best. Just one question. Am I on Zoom or am I on Facebook? Because I can hear two Dr. Bedos.
Look, to Dr. B, no, I think you are in Zoom right now. Maybe you need to drop
Okay.
in Facebook, or maybe
Yeah.
just switch the sound off on Facebook.
Yep, I'll do that.
Okay.
All good. Hello?
Uh, you see, Dr. Larry mentioned I'm putting my daughter to bed. I would love to. That's okay, Dr. Larry. Oh, good then. Okay, now let's discuss this case first. Okay.
Yes.
Now, if you look at this case here right now, this is the child is a 10-year-old boy. And
Mm-hmm.
then looking at his teeth, definitely he has permanent teeth. All the teeth right now are permanent in this stage, especially incisors and molars,
Yes.
right? Okay, that is great then. Which is the central incisors and the premolars, 10-year-old definitely erupted. So
Yep.
this is, if you look at the board part, because the most important thing for us in these cases is the task itself, which is take consent and address the patient's concerns and child condition. What do you think is, guys, what do you think is the cluster? Which cluster is this? We have mainly three clusters in this part, either information gathering or diagnosis and management planning or clinical treatment and evaluation. The word
It's
treatment,
for
yes.
the first cluster.
Okay. So
Or is
take
it
consent, address the patient's concern and the child condition. I would go with this is take consent. When we take consent mainly in two conditions,
before doing
right?
what?
Either cluster, it's diagnosis and management cluster, or
Mm-hmm.
treatment planning and evaluation.
Yes.
So I would go more toward treatment planning and evaluation cluster.
Okay.
Okay. So this case now, so you're going to focus mainly on the treatment.
Mm-hmm.
Okay. I don't want you to ask me multiple questions. I don't want you to, you're not a policeman, and then I don't want you to shower me with lots of unnecessary, irrelevant questions. I want you, even if you're gonna ask me questions, it should be a relevant question, gonna help you in the treatment part.
Mm-hmm.
Clear right now? Easy right now?
Yes.
Okay. Now, I will go through like later on. I'm going through this case nicely, but I don't want you to cheat, okay? I'm
Okay.
going actually to talk about what is molar incisor hypomineralization because somehow you may need to explain it quickly to the patient in very short, I would say in very short sentences, maybe one sentence mostly, and then
Mm-hmm.
causes. That is maybe you need to know as well. One of these causes can be the reason if it's really known, and then you need to say which type of this condition because based on the severity you need to manage. And then this is overall treatment. You cannot say all of this in a role play. But what you need to do is you need to mention about the treatment based on the severity,
Yes.
right? Look at the tooth, see which severity it is, and then start to manage. That's exactly what are you going to do.
Looks like mild to moderate.
Yes, you may even have different looking at the center incisor. It could have
Mild.
different,
Yeah.
yes, exactly. It may have different diagnosis than severity than the molar. Okay.
Okay.
Yep.
Mm-hmm.
So,
And take
have any
consent.
question?
So
Yes, please.
take consent for the treatment.
Yep.
So I will explain the treatment, the steps, and I will address their concerns, like what are they concerned about most, and the child's concerned as well. So like, for example, any difficulty in, like, let's just say eating, playing, sleeping, or is he getting bullied or something?
No, you don't need to go too deep in this part.
Okay.
Just only focus on the teeth right now, please.
Okay.
Okay, I need you to focus on the teeth. If there is any other information provided or any other information I have provided here, for example, or any other information that may actually the patients want actually to throw out, so in this case will be fine.
Mm-hmm.
Okay,
Okay.
but apart from this, you don't need actually to go that much deep details. Okay, very simple. What are you going to do in this tooth? On these two teeth, what are you going to do in this tooth? Engage the patient, talk to the patient, see if the patient has any question. That's it.
Mm-hmm.
Okay.
Okay, and so I'm gonna start as if it's a treatment planning cluster. So it's gonna
Yes.
be like the patient is already in the clinic. I've done the initial evaluation. Now it's the treatment part. So I'm gonna start with, okay, so David, I have taken some pictures and we can go through the pictures. And then I will explain to him that this is molar incisor hypoplasia and like why do I think it is?
Hypomineralization.
Hypomineralization, sorry about that. And
Hypomin-
then, for example, I will tell him what I can do for him and that, like, if he's okay with it and we can go ahead with it.
Yes. And maybe because the patient has some concern. One of the concern is how has happened.
Yes.
Right?
Okay.
So you need to tell me more about it. Very short. You don't need. I know you all study from Dr. Cameron book. You don't need to actually tell me page number 102 and then which is the second, third paragraph in a complete form. You don't need. It's
Okay,
just
so,
one sentence.
okay.
Yes.
Okay.
Okay. Okay. Easy
Okay,
now?
got it. Yes.
Very good. That's the way, guys. Okay. I can start right now, guys. Everyone, guys, excited? What do you think? Are you concerned or excited to Mubashir?
I'm very concerned, but that's
Why?
okay. But that's okay.
Okay, look, I will be very nice to you, not like you last time in my.
No,
You
no, no,
remember my
no.
role play with you? What did you do to me?
Yes, I remember. I'm sorry about that.
Should I act the same way you acted at that time?
That's okay. I want you to act anyway.
No, thank you very much. I
No,
like
no,
your.
be even if you want to be the worst patient, that's okay.
No, no.
I
In
want
this
to
case,
be
it doesn't.
I
It
want to
doesn't.
be prepared for anything. So
Okay,
fair
that
enough.
is good energy then. Okay, let me just show the meeting, and then from the meeting itself, we're gonna set up. We'll be happy to start now. 3 minutes reading for you, preparation or reading.
Okay.
Okay, let me just go to apps and from apps. Let's start the timer. The timer 3 minutes reading. Now, guys, we're gonna take 3 minutes reading. He's gonna write down his notes and the most important part, which is the bold part. He should divide bold part into. Okay. By the way, would you like me to help you in the consent part
Yes,
quickly?
please. Yes.
Okay. So the consent part is I need you to give me just a brief about the condition, not too much talk.
Mm-hmm.
You may say for that when you look at the center incisor, there is I would say chalky white appearance because the first layer is very thin. We call it enamel. It
Mm-hmm.
happens during the growth of the tooth time. Okay?
Mm-hmm.
Easy, that's it. Okay, and then the second, when you look at the molar, say there is the tooth has been a part of the tooth has been chipped off or broke down, and this is for the same condition we just explained right now. That's it. The patient may come back to you and say, okay, why this has happened? This has happened because of, there are different reasons. We're not sure exactly, but one of them, it can be an infection has happened to the child, or maybe the last trimester for the mom, she got some infection or some diseases. That could be a reason. Would you remember any of this? Right?
Okay.
Just try to engage the patient. This is all about the diagnosis.
And I should be talking about every single tooth, even like the you can see the bottom lateral incisors. I can see
You can.
some over
You
there
can
as
all the
well.
incisors. You can see all the incisors, yes, when you look at them.
Okay.
Yes. True. Okay.
Okay.
And then after this is about of consent. What else about from consent? I need to talk also about the severity. You can keep the severity during the treatment time. So let's
Mhm.
say, for example, when I look at the top front tooth, which we call it as incisor, by the way, you need to say what type of tooth. Is it permanent, is it an adult, or is it a baby milky tooth? Because
Mhm.
they sometimes the patient doesn't know, right? Patient
Okay.
doesn't know is that which one. So you say it's an adult tooth, right? And then that's why we need to keep it because that's it was again stay with him forever for Jack. I don't know what's the name of the child, Leo, right? And then you can say this is, but you know what? It looks really like it's not really that bad. It looks really okay. It can be fixed easily, nicely. It just a little bit because ice is just a mild condition. It's not really that much severe. So and then you can say what the treatment need to be done, and then a new treatment part you need to say, for example, how long gonna be the follow up visits when you need to see him again, the hygiene part if it's included, the cost maybe sometimes, and this is a consent part. Okay,
Okay.
short term, long term. What are you going to do today? What are you going to do in the next few months? What are you going to do if needed in the next 6 months, a year, or 2 years, or 3 years, if required? Okay.
For the sh okay, but for the short term, like I can do microabrasion, and if he needs that,
Look at the tooth and tell me what do you think?
and the
Microabrasion is required? I don't think so.
and the incisors,
Incisor, maybe yes. I would say microabrasion can be an incisor, yes.
and for like the molar ones, can I like
Restoration.
stainless steel crown, stuff like that?
Yes, but restoration will be enough because I don't think
Okay.
really it's that much damage in it. But
Hmm.
and this is actually going to prevent the future damage to the tooth in the molar part.
Okay.
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 Okay. Ready?
Okay.
Ready?
Yes.
I will be helping you. Don't worry. Okay.
Okay. But
Okay. 3 minutes reading now. All the best to you. Still, if you want to ask me any question during the 3 minutes, I will be happy to do
mhm.
it.
Okay.
And then later on, after you finish your role play, we're gonna go through the slides to explain every single condition and what exactly needed to be done. Please admit the candidates because the candidates actually on Zoom, they need to be admitted.
Like for example, discomfort while chewing. So
Yeah.
I kind of know that it's like, reversible pulpitis, but I will go through it even though if it's the treatment planning cluster.
Yeah, it's a
Like,
reversible pulpitis. So it means there is sensitivity here. So it means you need to do some restoration. So this is guiding you toward the restoration part.
no, but I will ask you, can you tell me more about the discomfort in the lower molar? Or should I just
Honestly, no need.
Okay. Okay.
But if you ask, it's your option. But I don't think it does need for anything.
Okay.
Yep.
I can't see the timer, so whenever it's up, just let me know, please.
No problem. You may find it on the top side on the screen. Zoom normally shows this way.
Oh, okay, yeah. I was on Facebook, that's why.
That's okay. 15 seconds left, and then we start.
Yep.
You can start right now.
Thank you so much, David, for being patient while I examined our Prince Leo over here. So I can see that you brought him in because he's been complaining of sensitivity and discomfort in his lower back teeth. Is that right?
Yes, doctor, you're totally right. Leo is a 10-year-old boy, and then he's very polite and very consistent what he's doing, and really seems like the front is really doesn't look the way which is supposed to be. Especially that's his sister. She is 13-year-old now, and she got the bestest ever. So, doctor, what do you think really has happened to Leo?
Well, I hear you. I completely understand where you're coming from. There, I can see. I took some pictures over here. Can you please come and we can look at the pictures together? Can you see the pictures which is like on the top over here, his top teeth? So I can
Yes.
see that there is white chalky appearance over here. So these are not so common, but it is a bit common, in especially in kids. Let's say who were when like when they were very young, they had some sort of infection, or let's just say during the pregnancy, his mom had some sort of infection. So do you recall
Mm.
anything of that happening to him?
Yes, doctor, you're right. I think he had some ear infection when he was about, I would say, 2 months, 3 months after birth. That could be the
Oh,
reason,
okay.
doctor.
Yes, that could be one of the reasons that why this has happened. And as well, I want to discuss one more picture which I took. Can you see the bottom picture over here?
Yes. Do you mean this, doctor,
Ye-
right?
Yes, the big molar over there. Yeah, that is also related. So these things are we call it actually molar incisor hypomineralization. So what has happened is that the mineral content of the tooth has decreased. So that's why we can see chalky appearance and we can see the breakdown of the lower tooth. Are you following me so far?
Yes, doctor, but I still have question here. Do you think these teeth are baby teeth or adult teeth?
No, all of these are adult teeth. I can see the front teeth, they are adult teeth, and the molar, which we can see over here, has hole, which he's complaining of discomfort, is also adult teeth. So we have to look out for this a lot because he's gonna have it for the rest of his life.
Oh, so it means like they never changed them.
No, they are not gonna change. Like they are not gonna replace themselves.
I'm
So these
worried
are
now,
adult teeth.
doctor. You really made me worried right now. I'm concerned. What if they going to lose a special? Which tooth, doctor, do you think actually may need to have a, a type of complex treatment?
No, right now you don't have to be concerned. I'm very happy that you brought him in early stages over here, and I can assure you that this is something which I can easily take care of. Like the bottom ones as well, they don't need complex
Really?
restorations. They do
Really?
need.
You're really nice dentist, and I really start to like you very much. Okay. So
Thank you.
I shouldn't be
Yes.
worried, right?
No, you shouldn't be that worried as long as I can see him every, let's just say, 6 monthly for a checkup and clean, and I'll monitor it for you, and I'll give you some instructions as well to follow for oral hygiene as well, so that we know that his teeth are clean. Because right now the mineral content of the teeth is low, so I don't want further breakdown. I don't want him to disappear and come back after, let's just say, 2 years with multiple holes inside his mouth. So I want you to be thorough with that. Would that be okay?
Okay, you're really making me very excited to know what is the type of treatment you will do today, then, doctor. Doctor, so what are you going to do today then?
So I can see that he was complaining about discomfort in the lower molar. So I can see that the lower molar is something which I have to treat because he's having pain over there. Is that right? Is he complaining of some pain?
Yes, it actually has pain most of the time when you chew on the tooth, but once we brush the tooth, it feels much better.
I completely understand where you're coming from. Yes, it happens. So what I will do for you is that I will remove the decayed part, the broken down part of the tooth, the hole. I will clean the hole and I will put a nice filling over there so that now all the nerves inside the tooth are protected. So he won't be feeling any pain when he eats.
Doctor, you said filling. What sort of filling? Is the same one we use it for adult people or a different one? The one we use it for kids. Which one do you recommend?
This one, since it is an adult tooth and he's 10 years old, and I can see that there is broken breakage over there, I will give him an adult filling. But what I will do for him is that I will do a special filling for him at the bottom, which will release high fluoride, and I will put a permanent filling at the top as well, which would be the same
Okay.
color as his tooth.
Okay, that is good then, the doctor. That is a good idea. Okay, no problem. Well, so what are you going to do the front top teeth then?
For the front top teeth, can I ask you, does it really bother him a lot, or does it bother you? Does he have any
Yeah, actually,
concerns
the
about
color
it?
really, yeah, the color actually, I know there is a little bit of sensitivity there. They are sensitive, and the color as
Mm-hmm.
well. I don't think really it's a good color, especially that sometimes people really bold him badly about this.
Oh no, where does that happen? Does that happen in school?
Yes, in the school, always in school.
Oh
Yes.
no, I would really suggest you to go and have a chat with with the school. We have no place for bullying over here. I really want you to go and have a good chat with the school, okay? And for the color, if it's really bothering you, I can do that. It's a procedure. So I can do multiple procedures. First of all, can I ask you when's the last time he went to the dentist? Has he had a clean done recently?
That was about 3 years ago
3 years ago. Okay, okay. So I,
when he
if
was
you,
7 year old. Yeah.
oh, okay, okay. So can I ask you why wasn't he at the dentist for so long?
Because actually I'm very busy, and then I'm actually divorced with his mom, so it's harder to
Oh.
see him. And then his mom actually lure him with lots of sugars and then lollies and all this stuff. She's not good at all. She's not good mom. No.
Oh no, I'm so sorry to hear that. Are you okay? I completely understand it must be very hard for you dealing with
Yes, actually, it's too
everything.
hard, and maybe she doesn't look him that much. I only see him
So,
once every month sometimes because I'm very busy too.
okay, so mostly he's with his mother?
Yes, and she gave him lots of lollies and
Oh
sweets.
no. Oh, okay. So what we can do is that we can book an appointment with the mother as well. She can come in and I will have a discussion with her as well. If you have good terms with her, you can discuss it with her. So as you said that most of the time he
But
is
she's
with his
she, she's
mother.
she's always angry and upset and stuff. We'll be able to handle her.
I will be able to handle her. Don't worry about that. As you said that he's mostly with his mother. So
Yes.
she's the primary carer of Leo.
Yes. Yes, we both.
Oh, okay, both of you are. That's okay. That's very good then. Okay, so and that's okay. You can just bring her in for the next appointment. What I will do is that I will, since Leo is over here, I can take the contact information and you can discuss it with her, and then I'll call her in for the next visit, and when she comes in, I will go through everything which I have been through with you as well. Would that be
Very
okay?
good. So yes, doctor. So what are you going to do for the top front teeth then?
Top front teeth, first of all, I would suggest that we start off with the clean, and then if we can look if it looks better, because even after a clean, the shade actually, we clean it so it looks pretty nice, it's sparkly. So if that's okay, we can stop over there. If it's still not okay, I can do a special procedure for you, which would be something called microabrasion if it's really necessary. So what I will do is that I will basically put a plastic rubber dam on top of his face, and I will use something similar to a shampoo. And what that would do is that it would even out the shade of the tooth. So if you are really worried about this tooth, we can do that as well. And if still it does not work, I can do something as well, which is resin infiltration as well. So that really helps to even out the shade as
So,
well.
doctor, what is this resin filtration?
It's basically what I will do is that I will place a drying agent on the tooth for about 30 seconds, and it really helps to even out the color of the tooth. So all
Okay.
these, can you see the white patches?
Do you
They
think
are,
really do we need this type? Is it restoration, right? Is a filling material, right?
it's not a filling material. It's a filling material is something else. That is a composite filling material, which we can do it as well, but that would be the next stage, I would say. But for the first stage, the resin infiltration itself is not a filling material. For what you are talking about, I completely understand. There is something called composite veneers. I guess you have heard about it. Is that right?
Yes, doctor, sometimes yes. No, no, I don't really need to talk about it, this one. So,
Oh,
doctor,
okay.
back again, how much it gonna cost this treatment?
So for the filling, I would cost it would cost you around the lower tooth. It would cost you around some $200 something. And
And do you think this for this procedure mentioned is that one visit is enough?
for the filling, I can do it today. And for the top procedure, we can do it in the next visit. And yes, one procedure would be enough.
Thank you very much. Time's up. You did very good then. I
Really?
good. I'm very happy. I'm very proud. There is
Okay,
no any
thank you.
unnecessary information about anything at all. You've been communicating very nice with everything.
Oh, okay. Thank you.
What? What? Why are you bumbling now?
When you said about the mother, I was like, oh, now he started. Now he
No, no,
started.
no, no,
I
no.
was like,
I'm not.
now he's gonna say that, oh, I don't have the custody of the child. What will you do
No,
now?
no, no, no. I thought you're gonna go that way. I said no, just to get back again to the normal
But
case.
Dr. Bida, what if the examiner says this? That I don't have the custody of the child.
No, that's look. They by law, actually, both of them, the parents, maybe the mom would be the first, right, and then the
Okay.
parents. But both of them, they actually, they are can be the carer or the guards for them. Okay,
Okay.
so there is don't worry about this part. Don't worry because
Oh,
otherwise he will not kidnap his baby. Then if he kidnap his baby, he will not take him to dentist.
oh yes.
Yeah,
Okay.
so if you kidnap him to do maybe take him overseas, right?
Yeah.
But
Okay.
not yet, not exactly like not for
Hmm.
dentist. So you know what? I'm very happy, guys. What do you think? Let's check, guys. Let's check the comment on Facebook. I believe everyone is very happy. Let me check.
No.
It was natural. Dr. Sabik, I agree on this 100%. Let me just do this one here. It was natural. Very good attempt, Dr. Mubashi. Dr. Parsi is saying this. And by the way, Dr. Parsi is a senior. So if he
And
mentioned very good
no,
for you, means you're really very good, huh?
me and Dr. Pasia talk on the phone as well, so that's okay.
You see,
Yes.
that's why then, you see, that's why it's good to have a good study partner.
Yes, thank you.
It's really good performance. Everyone like it very much. I'm really very happy. That should be give you good push. Really, because
Hmm.
I'm very happy with this, Dr. Mabash. Okay, so now why I'm happy? Because
Yes.
you haven't asked any single question which is irrelevant or unnecessary questions. There was no, even one single question. By this way, what you did is you actually managed your time nicely, which is the things most of the candidates they lose mark or they actually don't build up rapport with the patient.
Hmm.
For me, when a candidate's actually, you know what, I see the candidates in the academy for the first, I would say for the first look, and then I can tell them you passed OSCE, right? Even first time ever. If the candidates, if he came to the academy, I never met them. Once they start to talk to me, I said always say, you passed the OSCE, right? But you stuck in technical. They always say yes. Why? Because the things we're looking for, number one, when you talk, try to build up good rapport with the person you talk to. And
Hmm.
this is happening. Number one, you didn't waste my time, you didn't waste your time with unnecessary, irrelevant questions. Number two, you've been very nice to me, and then you simplified everything. When I mentioned about this condition, when I mentioned which condition it is, yes, when I mentioned about the molar, and then I thought, oh, that's really, I'm really worried that it's going to be a complex type of treatment. I said, no, it's not. It's just something easy. It's just filling or restoration. I was very happy. And then when you actually looked at the front teeth, you straight away didn't give a treatment or management without asking me. That's called engagement. You already engaged me. And then you said,
Mm.
do you really, really need treatment for these teeth? Do you really like bother you with the appearance out of this? And then I said, yes. So I was very happy. That's you actually engaged, right? Engaged me in your decision and then you took without even you decide yourself. When I tricked you, when I said about there is a bowling happening for this for him in school. You straight away managed it very nicely. You said, "Okay, we have no bowling in the country, so we need to talk to school." That was very good. When I mentioned the mom, that was another trick. You said, "Okay, let's talk to her." All of these hints, I was actually talking to you clinically situations, and then you managed every single one of it nicely. It was perfect. You explained what is motor incisor hyperplasia. Even your explanation was very nice explanation. Very clear explanation. I got it very nicely. When you explained about microabrasion, it was very nice. How the shade will fade away, right? How the shade will merge together. And was very nice. I like it. Very simple, easy. Some candidate keep talking, you know what we need to do is we need to place, you said the rubber dam. That's okay. I normally don't want it because I don't want to waste time. But yes, some people say we're gonna place a rubber dam. It's actually a rubber sheet, and then we're going to put it because that's gonna isolate the tooth, and then we're gonna clean it with acid. The acid is this, and then once we do acid, we're gonna do with the sand, the paper, or we're going to do it with we're gonna plast it with pumice, and then once we plast it, we're gonna keep it for some times, and then we're gonna wash. Oh, that is too much. You're not in Viva. So what you mentioned, just two words, right? And what you mentioned was very enough to understand the procedure. Was very good. And then you talk about resin filtration. When you said about resin filtration, I would consider resin filtration as a filling material still,
Okay.
because resin filtration it does fill the gaps or spaces
Mm-hmm.
between the porous yes, the porous parts in the tooth, right?
Yes.
Especially sometimes when you do and when you do a microabrasion, and maybe some of the weak enamel part, it will be separated from the tooth structure, and then you need to fill it back. And that's
Yes.
why we may need to use resin filtration for this part, right?
Mm,
And
okay.
then that was very good as well. What else? Ah, you remember when I speak about when I said the words for she's actually your him with lots of uh, f- uh,
Chocolates, lollies.
snacks and then sugars and all
She's very
all
bad.
this stuff. I wanted you only to cover the butt for diet chart. That's it,
Oh, okay.
right?
Yes.
I want you to say we may need to take a diet chart then.
Ah,
Okay?
yes. Okay.
Yes. But you know what you scored? I would say about what we mentioned right now, you scored up to 90 plus percent
Already?
because
Thank
yeah,
God.
yeah, honestly, in this case, you did very good. Even the cost and stuff, I was very happy. The restoration here, even you said composite, and I was composite. Why not? You said GIC in the bottom for fluoride and
Yes.
the top composite. Why not? Yeah, perfect. Will be very good.
I forgot I'm
Which
doing a
one?
case. I forgot I'm doing a case. I thought I'm talking to a patient and that's
Very
it.
good.
That's
That
what
is
I was
great.
thinking.
That's why I didn't mark up anything. That is, he didn't say, he didn't mention anything from books. Whatever I have mentioned right now, it was very natural coming out from you. I'm very proud of you. I'm very happy.
Thank you.
Okay, let's now go to the box. Do you have any question for me?
No, is this recorded? Because I kind of don't remember what I said, so I
Yeah, yeah,
will
recorded,
listen,
recorded, and
go listen.
I was planning to delete the recordings, but if you wanna hear it, so maybe I can keep it for 1 hour, 2 hours, and then I will after this delete the recordings. Okay?
Yeah, thank you for
But you
that.
did very
Yes.
good. You did very good.
Oh,
Okay, so
thank
guys, let's go now with information. Please stay with me. Okay? Don't go away, please,
yes,
because we gotta
yes.
discuss this together. So
Okay.
now, guys, what is molar incisor hypomineralization? Enamel is normal thickness but poor quality, as exactly you mentioned, right? It
Mm,
will look like white creamy opacities as this one, or maybe sometimes yellow brownish opacities, this one because of stains. Fragile enamel like the bottom one, maybe the top one can be fragile. Post-operative breakdown like this tooth, it has post-operative breakdown after eruption. The tooth has the part of the tooth has been chipped or broke down, as you see right now. Normally, first molars, which is this tooth, And sometimes incisors. Incisors, it can be central incisors, lateral incisor, upper or lower, like this case, right? Enamel near the gum line is usually normal, like this part, because it happens in the first years of the life, right, of the baby. Teeth can be very sensitive and hard to numb. Yes, sometimes. And that's why maybe a special referrer can be a good option, especially if it is
Hard to know.
severe type of cases. But this is not severe, so that can be managed by general dentist. What do you think about this, doctor?
Yes, it can be managed by general dentists. And just one quick question for the sensitivity part. Just Durafat?
Yes, the Durafag will be fine. Yes.
Okay.
Okay. Very
Yeah.
good. Then exact cause unknown happens during tooth formation. Easy, simple language. While the tooth grow, right, the formation of the tooth, this defect has happened on the first top layer. We call it enamel. That's it. Possible factors, childhood illness, like fever infection. That's why I mentioned about ear infections. All of these guys, it can be a reason, but normally the most common is a family history that it takes us more toward the intelligences imperfecta or intelligence imperfecta, which is very rare condition. So I would agree mostly about childhood illness rather than anything else, which is systemic, call it
Yes.
as systemic factors. Okay. Types based on severity. Mild. This case is mild. Why mild? White or creamy patches, as you see right now. White creamy. No enamel breaks. So there is no any broken down enamel, as you see, all sound. Little or no sensitivity. Yes, there's a little bit of sensitivity on this tooth. So that's why it's mild. Be careful, guys, about the types based on severity because the treatment, which is about this case, it will be related. I made it easy for you. So based on the types of severity, I will treat the condition. Sorry, guys, someone calling me on Facebook seems like. Hopefully, guys, you're not bothered by this. Moderate, yellow or brown patches, exactly this case. Small enamel breakdown, exactly this case. Sensitivity present, like this case. Severity, guys, can you hear me? Doctor, can you hear me?
Yes, yes, we can hear you.
Yeah, because there is a. Did you hear that someone calling me on Facebook? No?
Yes, we hear that. We heard
You
that
hear?
as well.
Okay, let me just put this one down.
No, but it's not annoying. You can just continue.
It's not. Okay. That's fine then, as long as. Okay, that's fine. Okay, that's now. Sorry, sometimes I need to do this. Okay, severity. Severe condition, you'll find large breakdown enamel, multiple molars affected, strong sensitivity and pain. This is not the case here. So now central incisor actually is mild, and central incisor actually mild, and then molar tooth is actually
Moderate.
moderate. Do you agree on this so far? Easy now, right?
Yes,
Okay,
yes.
very good. By the way, I know people they fail these cases badly, but what you did right now, it was great. Now, preventive fluoride toothpaste, fluoride vanish, CPP, ACP, sealants, or hygiene instructions, diet advice. Aesthetic, microabrasion, as you mentioned here, resin filtration, as you mentioned here, composite veneers. I don't want it in this case because well, it's not severe. And the restorative composite glass ionomer, as you mentioned, the lower tooth here, stylistic crown not needed because this is not severe condition. Do you agree so far about this?
Yes.
Yep.
Yes, yes.
Okay. Extraction ortho planning, consider only when the tooth is not restorable, but this tooth is restorable. Okay.
Mm.
Now, more incisor hypomineralization treatment by severity. Mild, more incisor hypomineralization. We now talking about the teeth conditions. This teeth condition.
Mm.
So we need to reduce sensitivity, protect the enamel, improve appearance. So our goals, three goals. One is reduce sensitivity, fluoride toothpaste for adult strength. It can be, I would say, 1,000 ppm more frequent time, right, for this
Yes.
child. Fluoride vanish at the clinic. CPP, ACP, tooth smooth at home. Desensitizing agent, sense toothpaste, maybe you can go with Sensodyne. Okay,
Yes.
Sealants, not needed in this case because that's a molar. Microabrasion, this is for improve appearance. Microabrasion, yes. Now, for sensitivity, we used fluoride. For
Mm-hmm.
appearance, we use microabrasion. Resin filtration for study improvement on front teeth. Okay, you mentioned it. Small composite filling if needed. You don't need for the front teeth. Review every 3 to 6 months. Doctor,
Yes.
do you have any question about this part, doctor?
No.
I can't hear your voice a little bit far. It's
Can
not
you hear
reaching.
me now?
Yeah, now I can hear you. Yes.
Yes, everything is
Everything
clear.
clear right now, right? Everything clear.
Yes.
So for incisor, so all of this slide, all this slide, just make it this way, mainly for this condition, for incisors. Okay?
Yes.
Why? Because our diagnosis for this incisor was mild more incisor hypomineralization. Now, the next slide will be for the molar. Okay? So now this slide will be for the molar.
Mhm.
What we need to do is protect weak enamel, this weak enamel. Control pain, because patient has discomfort and pain, especially when chewing. Restore function. Now, remove weak enamel. That's exactly what you mentioned. We're gonna remove it.
Yes.
Then we're gonna restore it with composite restoration. That's why we're gonna put composite. Glass ionomer as stem protection sometimes. And then what we do is we can cut down in this tooth, make a proper cavity, very conservative cavity, right? Or
With
maybe
composite.
even without even bare, without even hand pieces, you can use excavator and then just excavate, right? Whatever is soft enamel or soft dentin. If it's not soft, don't remove. You only remove if it's soft. Hard,
Yes.
keep it, right? And then you can place GIC in the beginning. And then if it's really deep cavity into the dentin, that's why you may need to take an X-ray. Maybe you can take an X-ray to
Mm-hmm.
decide how deep it is from the beginning, pre-apical X-ray, right? And then do just a little bit of filling here with GIC. Keep it for some times if you want. And then cut back in GIC. What does it mean cut back? Remove maybe 1 millimeter or 1.5 to 2 millimeter max, right? In GIC. Create a space for composite, then put composite on the top. That's it. Do you agree on this?
Yes.
Yes, still you can provide vanish or topical agents at home or at the clinic. Occlusal adjustments, this is actually happening for the composite, not for the
Mm.
tooth. We
Yes.
never remove from the tooth structure.
I
More
got you,
frequent
Jay.
recall every 3 months. Okay,
Yes.
very good. Now, this is for severe monocytic hypomineralization. In this case, what we need to do is, this is not the case here. Let's say if the molar is badly broken down all the way here and there, right? In this case, we have different options. One, or actually the goal long-term planning, protect bites, prevent complications, especially malocclusion and spaces. Full coverage, stainless steel crown if it's badly broken. Multi-surface composite or only if the patient is adult enough, right? And then if it's really badly broken and cannot be saved, in this case, you may do extraction. In here, in this case, I believe it should be done by specialist. Pedodontist, not by us. Severe cases, not by us. Why? Because they are the one going to decide if you really need extraction or not, stainless steel crown or not, and all this stuff. We keep severe cases of more instances of hypomineralization and even anesthetic. Anesthetic will not work in severe cases. The tooth is very sensitive. Even if you give anesthetic, it will not work. Even nerve block. This is our experience with it. And then do extraction. And then after the extraction, you need consultation with orthodontic as well because they may use transparatal arch or whole A appliance. And then every 3 months will be done. What do you think about this, doctor?
Very good. It's very nice.
Very nice, right? Easy case. I don't
Yes.
know why they get stuck with this type of cases. Believe me, all clinical cases like this. There is no hard clinical cases.
Even patients come in like this.
Yes,
That's the
you
same
see.
things.
Yes, the patient actually come and ask the same question. The patient actually be in the same situation exactly, right?
Yes, exactly the same thing. I have seen it like last week.
You have seen the same case last week.
Yeah, he was 10-year-old. He was quite chubby. He was getting bullied at school, and they were not fully erupted. So the
Mm,
mother wanted composite veneers. And she
mm.
was like, no, my friend got composite veneers. Look at this. I want composite veneers. So we
So,
had to explain to her that right now we have to wait for the tooth to erupt completely, and at the meantime we can do microabrasion, this, that, fluoride, bullying is not good, everything.
yes, that's very good then, right? For if the central incisor, if it can be composite, yes, direct restoration can be. If it's direct restoration,
Yes,
right? Direct restoration, which is composite direct, which is not actually indirect, like not an
in the
porcelain
lab.
veneers.
Yeah, yeah,
Porcelain
yeah.
veneers we may keep it later on until the maturation of the gamma stabilization of the periodontium is about 18 to 21 year old. This is if the person composite it can be done. Veneer will be okay, but it need to be replaced maybe within 1 year or 2 years because actually will be showing once the tooth is completely erupted. I agree on this.
Yes.
Right? That was very good then.
And I
Okay,
didn't mention X-rays as well. But
that's okay. Look, this is
but I don't
extra.
know. I think you don't have to complete the whole case. You just have to
Very good. Thank you very much. You got the trick right now.
yeah, you just have to manage their concerns and stuff.
Very good. You manage as much as you can, as long as what you have said it does make sense. You didn't waste your time. You communicate very well. You engage the patient nicely. My concern be covered nicely. That's it.
Mm.
No one in this life can include every single word in everything.
Mm.
Okay.
Yes.
Yes, that was very good then. Okay, let me check what's happening on the Facebook. Okay. That's very good, guys. I believe we did very good. Well, guys, what do you think, guys, about this session? Would you like guys to have more sessions like this? Dr. Larry said, and address every single concern. That's a key.
Mm,
I
yes.
totally agree on that. Totally. The bold part and every single concern. I totally agree on this. Let me just get this one to check what they're saying. Yes, guys, would you like to have a session like this? So every Tuesday you have a session like this, okay? And I'm really, really very happy. I'm very proud of you, Dr. Mubasher. I'm
Thank
really
you
very,
very much, sir. Thank you. Thank you
really,
so
very
much.
proud. Thank you very much. Doctor, okay, very good. Definitely, okay, very good. Okay, guys, please, guys, if you have more cases, please let me know what are the topics of these cases so we can actually discuss these topics you want. Okay, Doctor, more sessions? Yes, yes, please. Yes, perfect session. I'm very happy, guys. Are you happy with this? And by the way, that's the way everyone has passed the OSCE, and that's the way how everyone passed the EDC exam with this good job.
You're talking
Next
about
time,
me?
me, yes, definitely you,
Oh, okay. Thank you.
which is very good job. Yes,
Oh, thank you so much.
excellent. No problem, doctor. Next time, me or Doctor Lev. Okay, definitely. Why not? Yes, more session. I totally forgot about extraction and what to do if happen to have to do that. Yes, specialist. Refer to special in this case. They go into the auto treatment most of the time. Say more gold standard session, please. Yes, I will do this as well. Yes, very interesting. Well done, doctor. Very informative. It was good session. I agree in this, Dr. Sarah. Doctor, more sessions, yes. Yes, perfect session. I'm very happy to read this. Definitely, please. Love it. I love it too, Dr. Melsman. And believe, Dr. Navdeep was amazing. Definitely, she came to help everyone. That was very amazing, and Dr. Mubashir as well, like it on the same track, I would say. Dr. Mubashir, same track.
Thank you so much, sir. Thank you.
Yes, honestly, I can say. You need only to work on technical now, okay? I'm
Yes.
sure now about your Oscar will be fine. I need to see you
Thank you.
work on technical then.
No, 50-50. Both have to go together.
Yes, but look,
Yes.
I know what I'm talking about, okay?
Thank you. Thank you so much. Yes.
Yes. Good job, doctor. Yes, he did a very good job. Yes. Yes, please, Dr. More sessions. Yes, Dr. Pre, definitely. Very interesting. Yes, very much, Dr. Musa. Yes, Dr. Saral. Yes, we love this session. Thank you so much, Dr. Bido. This session definitely done to me something. I'm very happy. I'm very happy, Dr. Saral, for to hear this from you.
And the people who gave the exam before,
Yeah.
uh, who got this case, I would really appreciate once we get a case, they could write the questions that the examiners asked. Because even the last OSCE we were doing with Dr. Raj, some of the candidates they actually wrote down the questions which the previous examiner did ask
Yes.
them.
So as we because we do like if you in this our sessions when you do like examiners because actually so every question guys we actually ask during what's called during the role play we do for you. Please guys write down all the stuff because actually it is
Helps
very
everyone. Yeah.
right? Yes, it's really very important what we discuss right now. So please, guys, write down all the questions we say right now because this is really going to be very important. Yep, I agree on this. Okay, guys, I believe we done everything right now in the right way, and then everyone is happy. So all the best to you guys. See you then tomorrow, part one champions. We have a session tomorrow on Wednesday, and then I see you guys part two for technical on Thursday, and then we may have another session either on Friday or Saturday. I will be announced very soon. Okay. Thank you very much, you guys. Thanks very much, Dr. Mubashir, for this. Thank you very much. No worries, Dr. Amna. I will be doing this. Thank you very much, guys. And then we'll see you all in the next session. Thank you very much. Thank you, guys. Have a great day, night, every one of you guys. Thank you very much. Bye bye. Bye. Thank you, guys. Thank you very much, you guys.